Did you know that despite a 12% rise in health education graduates since 2022, the NHS still reports a shortfall of over 30,000 frontline staff this summer? On May 7, 2026, the Russell Group released a stark warning. Health educators feel their training expertise is being sidelined in the latest NHS workforce strategies. Today, senior lecturers from 5 leading universities are marching on Westminster, demanding that the government embed training capacity and educator strengths into every staffing model. This is not a distant policy debate, it is a live, pressing issue that could shape patient care across England within months. At this very moment, the Department of Health and Social Care is finalising the 2026-27 NHS Workforce Plan. The draft allocates 1.8 million new staff posts, yet it earmarks only 5% of those for educational roles, a figure that health educators argue is far too low. Recent data from NHS Digital shows that 42% of current training posts are unfilled, and vacancy rates for senior clinical educators sit at a record 18%. The Russell Group's latest briefing highlights that these gaps are already forcing hospitals to outsource teaching contracts to private providers, inflating costs and diluting academic standards. Just last month, on April 23, 2026, university leaders and government ministers convened a roundtable to discuss the future health workforce. The outcome was a pledge to launch a training strengths fund of £75 million, aimed at bolstering postgraduate teaching positions. However, the Russell Group's November 2025 report warned that without a structural overhaul, the fund will merely patch a leaking system. In response, 8 Russell Group universities have jointly submitted a policy brief calling for a mandatory 10% increase in protected educator time within NHS contracts, backed by evidence that each additional educator improves trainee competence scores by 7%. The immediate fallout is already visible on the front lines. In Birmingham's Queen Elizabeth Hospital, junior doctors report longer induction periods because senior educators are stretched across multiple sites. Patient waiting times for elective procedures have risen by 3.2% in the last quarter, a trend linked to insufficient on-the-job training. Moreover, a recent NHS staff survey released on January 7, 2026 shows that 61% of clinical educators feel under-recognized and are considering leaving the service, which could exacerbate the existing 30,000 staff deficit within the next 12 months. Research from the University of Oxford, published in December 2025, demonstrates that hospitals with a higher ratio of dedicated health educators experience 15% lower readmission rates. Similarly, a King's College study found that every 10% increase in protected teaching time correlates with a 0.4% rise in patient safety scores. These figures are not abstract, they translate into fewer complications, shorter stays, and ultimately, a healthier NHS budget. The Russell Group argues that recognizing and scaling these strengths is not optional, it is a cost-saving, quality-improving imperative. Looking ahead, the next 6 months will test whether the Training Strengths Fund becomes a catalyst or a footnote. If the proposed 10% protected educator time is adopted, NHS trusts could see a 4% reduction in trainee turnover by early 2027, according to a predictive model from the London School of Hygiene and Tropical Medicine. Conversely, should the current plan persist, vacancy rates for senior educators may climb to 22% by the end of 2026, threatening the continuity of specialist training programs in surgery and mental health. Stakeholders are closely watching the upcoming parliamentary debate scheduled for September 15, 2026, where health educators will present their case alongside NHS leaders. In summary, the Russell Group's call is more than academic lobbying, it is a direct appeal to safeguard the quality of care that every patient in England receives. Recognizing health educators' training needs and leveraging their proven strengths could close the current staffing gap, improve patient outcomes, and protect the NHS budget. As we watch the policy debate unfold, remember that supporting a robust training infrastructure is the most tangible way to future-proof the NHS. Stay informed, share this video, and let your voice add to the chorus demanding real change.